Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to officially welcome you to episode 16 of the Ask Dr. Angela podcast. I saw the nicest patient today, and the reason that she was so nice is that prior to my going into the exam room, there was a 4x6 note card, those really old school note cards that, your mom used to write recipes on, white, the lines, the whole deal. At the top of the note card, it said Dr. Angela, and underneath there were just some various facts about this patient's, medical history, family history, etc. So when I saw that, it totally made me smile because I thought to myself, oh my gosh, this is such a throwback. So old school. So I walk into the room, introduce myself. I asked the patient, I said, who did this? And she looked at me and she said, my mom. My mom wrote all that down for me. I guess it really made me smile and get all warm in the inside because I'm always reminded of just what a privilege and honor it is to take care of patients and women in general. But the thing about this note card is that it was a huge reminder, just huge, that this woman that I'm about to see and provide medical care for is someone's daughter. And hence, it's my responsibility to take really good care of her. I occasionally like to just share these kinds of small tidbits of my daily practice life, but that really just kind of touched me in a special way. So having said that, let's move right into today's question coming to us from Dr. Z from Utah. Dr. Z, what do you have for us today?
Hi, Dr. Angela. This is Dr. Z from Utah. I have a few questions for you regarding endometriosis. What is the average size of tissue removed during laparoscopy for the diagnosis of endometriosis? And how many areas do you usually biopsy? Can you also tell me what instrumentation you use to complete this procedure? Thank you very much.
All right, Dr. Z, so you're hitting me with the big guns today, endometriosis. I'm surprised that I haven't had a question about this just yet. But anyway, let's start with what the heck is endometriosis? People, you know what it is. It's oftentimes characterized by cyclical, painful periods. And Dr. Z, I like your question because you implied a couple of things. Number one, you're asking me about surgical technique, biopsies, size of biopsies, etc. So right off the bat, I already know that you know that endometriosis, while oftentimes we diagnose it by history alone, i.e. cyclical painful periods, the true official way to diagnose endometriosis is going to be by a laparoscopy. And typically findings that we'll see at the time of laparoscopy. And for those of you that don't know what a laparoscopy is, that's a surgery where we put a camera inside your abdomen and pelvis, typically through a very small incision that's infra or supra-umbilical, either below or above the belly button. And it allows us to see what's going on the inside. And some of the things that we might see in a patient that has endometriosis might include things like an endometrioma, which is a characteristic chocolate cyst that can appear in the ovary, or also powder burn-like implants that can be present anywhere in the pelvis. It can be on the ovaries, it can be in the cul-de-sac. Endometriosis can be on the bowel, it can be on various parts of the peritoneum, it can be on the appendix. Endometriosis literally can be any and everywhere. So what is endometriosis? Let's start with the period. Normally, the blood and the tissue that you shed, that's the lining of your uterus. And that's what you shed every month as your period. What happens with endometriosis is that this lining or these glands that typically, again, is shed as your period, gets shot out through the fallopian tubes, and that tissue implants on various aspects of your pelvis. It can be on the ovaries, the cul-de-sac. It can, again, implant on the bowels, etc. Now, Dr. Z, with regards to specimen size, you're probably talking millimeters or maybe centimeters, depending on how aggressive the surgeon is. For me, I typically biopsy the specimen that best presents itself. I'm going for the biggest endometriotic site possible, only because I think that there's less risk when you go to a spot of endometriosis that is larger versus smaller. When you try to get into dissecting really small samples of endometriosis, I think that you get into a greater risk of causing injury to neighboring organ systems, which of course is one of the risks of surgery, injury neighboring organs, bowel, ovary, vasculature, etc. So for me personally, I like to go for the obvious and the most apparent sites. If that's on an ovary, I'll biopsy a piece of an ovary. If it's on a piece of peritoneum in the cul-de-sac, I'm more prone to do that. If it's on bowel, I tend to stay away from bowel, as I don't want to cause any significant injury to any of the vital organs that are also in the vicinity. I like cold scissors. Some people also use Kleppingers, which is a heated instrument that works by bipolar energy. I tend to stay away from the Kleppingers because I find that it damages the tissue and creates a lot more artifacts for me. So I try to get my specimen with just cold scissors and just cut it off. Certainly every surgeon practices a bit differently, Dr. Z. I tend to be probably not as aggressive as some of the others because I think less can sometimes be more, and I like to minimize my risk of injury. I certainly hope that this has answered your question. Thank you so much for tuning in and submitting. For your troubles and for your time, which I'm sure is very precious, someone from my team is going to be reaching out to you to gather your information so that we can send you one of our bomb-ass t-shirts. If you would like to have one of your questions featured on the Ask Dr. Angela podcast, please visit us at AskDrAngela.com. That's AskDrAngela.com. Go to the website, click on the microphone on the side of the page, and do what you do. In closing, I'd like to leave you with this. Life's problems wouldn't be called hurdles if there wasn't a way to get over them. Until next time, look better, feel better, be better. Looking forward to reconnecting in episode 17.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.